All right, now to some concerning health news. A West Texas county is dealing with a measles outbreak. There are 10 confirmed cases in Gaines County. 8 of those cases are in school-aged children.
It's pretty scary. Well, joining us to offer some perspective on this is Dr. Peter Hotez. He's the Dean of the National School of Tropical Medicine at Baylor College of Medicine and co-director of the Texas Children's Hospital Center for Vaccine Development. Dr. Hotez, good evening to you. So health officials in West Texas say that all of these people were unvaccinated. How concerned are you that we'll see more cases because of those lower vaccination rates?
That's right, because we are seeing an increase in the number of parents who are requesting exemptions from school-based vaccinations, and including the vaccine for measles, which we call MMR, measles, mumps, rubella vaccines. And these particular cases are in Gaines County, where there's a pretty tightly knit religious community that has some of the lowest vaccination rates in the state of Texas. And oftentimes measles is the first breakthrough infection we see, because measles is probably the most highly transmissible virus we know about. So the minute you see a decline in vaccination rates that are significant, often below 90% of the community, which you need for herd immunity, that's when you start seeing measles outbreaks. So in some ways they're predicted and predictable, and that's what we're seeing here.
Well, what are the federal guidelines when it does come to the measles vaccinations?
Well, the requirement for most schools is that you receive 2 doses of the vaccine, one in your first year of life, usually around the age of 1, which that first dose gives you about 93% protection against measles, and then a second one right around the time of school entry, which makes it around 97% protective. So it's one of the safest, most effective vaccines that we have, but unfortunately a lot of parents aren't getting the message, or they're downloading a lot of disinformation about measles. And here's why we have to care. Measles is a bad actor. A number of those kids now from Gaines County, where the outbreak is occurring, are now hospitalized. On average, between 20–30% of kids who get measles require hospitalization. People are often not aware of that. And also the complications. About 5 to 10% will get measles pneumonia, which can lead to death. Also, measles otitis, measles virus infection in the air, leads to deafness. You can also see permanent neurologic illness. So it's not a disease that you want to be glib about. You need to make it a priority to have your kids vaccinated.
Wow, that's so scary.
Well, we do know that a couple of weeks ago, Houston reported 2 measles cases related to international travel. So should adults planning a trip overseas get vaccinated again?
You know, if you go to the State Department website, they may be a travel advisor. You talk to a travel medicine physician, and if there's a lot of circulating measles, and now we're seeing more and more of it globally, that's something to certainly think about. And remember, right here at home, now that we're starting to see more and more measles, because we have a pretty strong anti-vaccine movement in the state of Texas and anti-vaccine sentiment, we're going to see more of this. In the pre-vaccine era, usually measles peaked around late winter, early spring. And guess where we're headed in a few weeks? Late winter, early spring. So I'm worried these numbers are going to go up again.
That's definitely concerning. Is it ever, though, too late to get vaccinated for the measles, or is that something that you can do if you aren't vaccinated at any time?
Yeah, if you're not vaccinated anytime, you definitely want to do that as soon as possible. And at some point, you might even have to consider a second dose if you were vaccinated as an adult a long time ago. And either there's a lot of measles transmission going on, or if you're visiting an area where there's a lot of measles transmission.
All right, Dr. Peter Hotez, thanks so much for explaining that. Definitely concerning. We appreciate you filling us in.
Thank you.